Good morning. Coming to our next lecture, that is insulin and the other anti-diabetic drugs. Apart from that, we are going to see a brief, overview about the different hormones and related drugs. So before we start with insulin and the other anti-diabetic drugs, we must first know what is diabetes. So we all are aware of diabetes and we all know what is diabetes. So diabetes is the elevated blood glucose levels in the body. Now why does this diabetes occur? It is due to either absence or inadequate secretion of insulin. Now this can be associated with or without impairment of insulin action. That leads to diabetes mellitus. Now we are telling that there is a problem in insulin secretion or the action of insulin in the body if a person suffers with diabetes. So what is insulin? What is the importance of insulin? Insulin is a hormone which helps to distribute the glucose into the cells of the body to give them energy. That is the basic function of insulin. But sometimes what happens is the body does not make enough insulin, or the body doesn't make insulin at all, or insulin is secreted but the body doesn't use it. So these are the three conditions in which there will be problem either with the secretion of insulin or with the use of insulin. So in such situations, what will happen? The glucose fails to go into the cells and it remains in the blood and leads to increased blood glucose levels, which is denoted as diabetes mellitus. Now, prolonged increased levels of glucose in the blood leads to other serious effects, such as it can damage the kidneys, it can damage the eyes, nerves, it can lead to other dental and heart problems. That is why it is necessary that the glucose which is present in the blood, it goes to the cells, it distribute itself into the cells to provide them energy. Now, how can we diagnose diabetes? There are many different tests. The glucose test, fasting blood glucose test, oral glucose tolerance test, random glucose test, and another test which is known as HbA1c test. So we all are aware of all these tests. So fasting glucose test is the test which is done, the blood test which is done after the person fasts for at least 8 hours. That means he or she does not drink any sweet drinks and does not eat anything. They can drink water, but they should not drink any sweetened beverages and does not should not eat anything. So that is known as fasting plasma glucose test. If the person is normal, the levels will be less than 100 mg per deciliter. Pre-diabetic are considered to have a level of 100 to 125 mg per deciliter, and if a person is diabetic, then it can be anything more than 126 mg per deciliter. Next, coming to the oral glucose tolerance test. In this, the person is seen how the person's body is able to tolerate the glucose. So this is usually done after giving a person a sweet drink and then testing the blood glucose levels after 2 hours after giving the sweet drink. So this shows how the body is able, how the body is able to, process the glucose, how is the body working on that glucose levels. So normal it will be less than 140 mg, pre-diabetic 140 to 200, and diabetic will be more than 200 mg. So these levels are derived from the American Diabetic Association. Random glucose test means randomly at any time of the day this blood test can be done, and if a person is diabetic the levels will be greater than or equal to 200 mg per deciliter. Another test which is known as HbA1c. Now this test, from the name you can identify HbA1c means it is a test which occurs in the blood only, but it is, a glycated hemoglobin test. So hemoglobin, it is present in the RBCs which carries oxygen. So it becomes bonded with glucose in the bloodstream. So that is determined with the help of this test. So if the HbA1c level is below 44 millimeter per mole, it is considered as non-diabetic. If it is between 42 to 47, it is considered as pre-diabetic. And if it is anything more than 48 millimoles per deciliter, it is considered as type 2 diabetic. So these are the different tests and the different normal ranges. What are the risk factors of developing diabetes? Age can be a risk factor. Family history is a risk factor. Weight is a risk factor. Physical inactivity is also a risk factor. And other health problems such as high blood pressure can also lead to the development of especially type 2 diabetes. Symptoms: too much of urination will be seen. The person feels very thirsty and hungry all the time, even if the person is eating. Fatigue, the person is very tired. Blurred vision will be seen. If the person has any cuts or bruises, then they will be very slow to heal. Weight loss can be seen, although the person is eating very well, but still there will be weight loss, and there will be numbness, pain, or tingling sensation in the hands and the feet. So these are the symptoms which are seen when a person is diabetic. Coming to the two types of diabetes, the first one is the type 1, the second one is the type 2. The first one is known as insulin dependent diabetes mellitus. That means the person is dependent on insulin. That is why it is known as insulin dependent diabetes mellitus. So in this, what is happening? There is severe insulin deficiency, maybe due to the destruction of the beta cells in the pancreas. The pancreatic beta cells are responsible for secretion of insulin. So if there is destruction of pancreatic beta cells, there will be severe deficiency of insulin. So this can be diagnosed in any age people, usually seen with children and young adults, but it can be seen at any age. So insulin replacement therapy is necessary. That means the patient has to be given insulin in the form of a subcutaneous injection. The next type is non-insulin dependent diabetes mellitus. That means the person is not dependent on insulin. So in this, what will happen? This type of diabetes mellitus is characterized by resistance of the tissues to the action of insulin. So in this, there might be a mild deficiency of insulin secretion, but even if insulin is secreted, as I told you, the body is not able to utilize it properly. So the cells have become resistant to the action of insulin. This leads to the increase in the levels of blood glucose. Now such type of people, they might not require insulin to live, but If insulin is given, it will be beneficial for them to control their diabetes. Also, this can be seen at any age people, but mostly it is seen in middle age and older people. Now, this type of condition, the diabetes can be controlled by exercise, weight reduction, or by controlling their diet also. Now we will see about insulin. We have already seen about the diabetes. What are the types of diabetes? What are the risk factors? What are the symptoms of diabetes and how to diagnose it? Now coming to insulin. As I told you, insulin is secreted from the pancreatic beta cells. There are drugs which can stimulate the secretion of insulin. There are drugs which can inhibit the secretion of insulin. So among the stimulatory drugs, we have sulfonylureas as the major category. Among the inhibitory drugs, we have diazoxide as a drug which can inhibit the release of insulin. The liver and kidney helps in the removal of insulin from the secretion. 60% of insulin is removed by the liver and 40% of insulin is removed from the kidneys. So we are telling that insulin helps to reduce the levels of blood glucose. Right. So what is the insulin doing? It is usually acting by binding to the insulin receptors on the cell membrane. And after a series of intracellular reaction, what will happen? It causes increase in the uptake of glucose. It causes increase in the activity of an enzyme which is known as glycogen synthase, and it causes increase in the formation of glycogen. Now, what is the importance of glycogen synthase? Glycogen synthase helps in the conversion of glucose to glycogen. So, all the mechanisms are responsible for pushing the glucose away from the blood. So, either the glucose is converted to glycogen and stored in the muscles, or it is sent to the cells, leading to decrease in the levels of glucose in the body. Now, insulin stimulates the storage of glucose. As I told you, it stores the glucose in the liver, it stores the glucose in the adipose tissue, and it also stores the glucose in the proteins, in the muscles in the form of proteins. So in the liver, it is stored in the form of glycogen, and in the adipose tissue it is stored in the form of glycerides, and it is stored in the form of amino acids and proteins in the muscle. So always this glucose is sent to the liver, adipose tissue or muscles, and it is stored there. It is pushed away from the blood, and from there the glucose is utilized for energy. In the muscles it is utilized for energy. Now this is one action by which the glucose is pushed away from the blood. Apart from that, it inhibits the breakdown of triglycerides, glycogen, and protein, and it will not allow these, agents to convert into insulin. It will inhibit the formation, sorry, it will not allow these agents to convert into glucose. So it will first push the glucose away from the blood, and also it will not allow the formation of new glucose, that is gluconeogenesis. So it will prevent the breakdown of triglycerides, glycogen, etc., and it will inhibit gluconeogenesis. This insulin cannot be given orally, it is given in the form of IV and subcutaneous injection. Now, what are the therapeutic uses? It can be used in the treatment of insulin dependent diabetes mellitus. Diabetic ketoacidosis. What is diabetic ketoacidosis? It is a condition in which ketones are there are high levels of ketones in the body. So it is a life-threatening condition in which there will be deficiency of insulin, and it will lead to major problems in the body. It usually is seen with people who have type 1 diabetes mellitus. Now, other oral anti-diabetic agents are sulfonylureas, biguanides, meglitinides, thiazolidinediones, and alpha-glucosidase inhibitors. So, from each category, we are going to see one drug. Sulfonylureas, it lowers the blood glucose levels in the normal subjects as well as the people who have type 2 diabetes, but it is not effective in people who have type 1 diabetes. These agents, they promote the release of insulin from the pancreas. So basically these agents, they bind to the sulfonylurea receptors which are present on the pancreatic beta cells and cause the release of insulin. The next are the adverse effects. Now adverse effects, it will cause, because it is causing a increase in the release of insulin, it will cause hypoglycemia. Other minor adverse effects are nausea, vomiting, diarrhea, constipation, etc. will be seen. Hypersensitivity reactions can be seen. Photosensitivity can be seen. Photosensitivity means the person becomes sensitive to sunlight. Sun allergy, it is also known as sun allergy. Leukopenia will be seen, that is decrease in the levels of leukocytes. The next category is biguanides. The most widely used drug is metformin. You might have seen if somebody suffers with diabetes, usually metformin is prescribed. They are different from sulfonylureas because they do not cause hypoglycemia in non-diabetic patient except if overdose is given. Now, how do they decrease the levels of blood glucose levels of blood glucose in the body? They suppress the gluconeogenesis. That means they do not allow glucose to be formed. They suppress the glucose output from the liver. Apart from that, they enhance the movement of glucose in the muscles and in the fat. That means they push the levels of glucose from the blood to the muscles and fat. They inhibit or reduce the intestinal absorption of glucose, and they promote the utilization of glucose by causing glycolysis, that means breakdown of glycogen. So all these actions helps to reduce the levels of glucose in the body. Side effects are abdominal pain, nausea, vomiting, metallic taste, diarrhea, etc. will be seen. The next agents are the thiazolidine diones. Thiazolidine diones. In this we have rosiglitazone and pioglitazone. Now these are a little weaker anti-diabetic drugs, especially when they are used alone. But when they are used in combination, they give a good improved glycemic control. Adverse effects seen are weight gain will be seen, anemia, edema can be seen, other cardiovascular problems can be seen, congestive heart failure can be seen. Now there is a drug interaction with pioglitazone. The antifungal medication ketoconazole, it inhibits the metabolism of pioglitazone, and failure of oral contraception will also be seen with pioglitazone. pioglitazone therapy, when a person is on pioglitazone therapy. The next drug belongs to alpha glucosidase inhibitors, the acarbose. The importance of acarbose is it delays the digestion of carbohydrates immediately after taking food. Immediately after a meal, it delays the carbohydrate digestion. It prolongs the digestion time. Thereby, what will happen? It reduces the rate of glucose absorption also. So, lowers the postprandial hyperglycemia. Immediately after we eat, the levels of glucose will increase in the body, right? So that levels are controlled by acarbose. It is obtained by fermentation of a fungus which is known as Actinoplanes utahensis. It is used in the first line therapy of non-insulin dependent diabetes mellitus, which is inadequately controlled, and it can be used in combination with other oral hypoglycemic agents. Adverse effects include, diarrhea, flatulence, pain, abdominal distension can be seen, and rarely liver impairment or liver function impairment, skin reactions can be seen. Next, coming to its implications in dentistry. What will happen if a person suffer with diabetes mellitus? What will happen to their teeth? So as you all know, caries, such type of people are very caries sensitive. That means they develop caries, they develop other gum diseases, periodontal diseases, oral candidiasis can be seen. And for such type of people, if the dental procedure is short, then it will not have any problem if a local anesthesia is given. But for prolonged procedures, for long procedures, especially if general anesthesia is given, then blood glucose level should be monitored, and if needed, then the perioperative period should be regulated with in subcutaneous injection of insulin. Next is if the diabetes is uncontrolled, if a patient is there and he or she is suffering with severe uncontrolled diabetes, then IV infusion of insulin glucose can be given to the patient during the procedure. And for people who have poorly controlled diabetes, antibiotics should also be given because their healing capacity will be very poor. So they might develop any other infections. For such people, such diabetic people, prophylactic antibiotics should be prescribed. Next, coming to glucagon. Glucagon is also secreted from the pancreas, but they are secreted from the alpha cells of pancreas. Insulin is secreted from the beta cells of pancreas. Now here glucagon is having opposite effect to that of insulin. That means this glucagon will cause increase in the levels of blood glucose. How does it cause increase in the level? It causes catabolism of stored glycogen. That means whatever is stored, it will cause breakdown of that, and it will increase the levels of glucose in the blood. So it will cause catabolism, that is breakdown of stored glycogen. It will cause increase in the formation of gluconeogenesis. So it will cause increase in the levels of glucose. This can be used in hypoglycemic conditions. So it is used in emergency treatment of severe hypoglycemia. So if the patient is suffering with hypoglycemia, glucagon can be given. If the patient does not respond to this, treatment, then medical help and intravenous glucose administration can be given to the patient. So that was about the oral anti-diabetic drugs. Next, coming to the hormones and related drugs. So hormones are substances which have biological activity and they are produced from specific cells in the body, and they are transported through the blood to reach their target cells. So hormones are basically secreted by glands, the pancreas, pituitary, adrenal, thyroid gland, etc. From the pituitary gland, hormones are secreted from the anterior pituitary as well as posterior pituitary. The different hormones that are secreted from the pituitary gland are the growth hormone, the somatotropic hormone, thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone, and the luteinizing hormone. From the posterior pituitary, oxytocin antidiuretic hormone is secreted. Thyroid gland secretes thyroxine, that is T3 and T4. Thyroxine is T4, triiodothyronine is T3. Parathyroid hormone secretes parathormone. Pancreas secretes insulin and glucagon. So insulin is secreted from the beta cells, glucagon is secreted from the alpha cells. The adrenal glands, they secrete glucocorticoids, adrenaline, mineralocorticoids, noradrenaline. Also, these are secreted from different parts of the adrenal gland. The cortex secretes the corticosteroids, and the medulla secretes adrenaline and noradrenaline. Gonads secretes estrogen, testosterone, progesterone, etc. We will see briefly about the few hormones. The first one is the growth hormone. Now, growth hormone, from the name you can understand, it is responsible for the growth. So it can cause stimulate growth either directly or in conjunction with other hormones. So hyposecretion of growth hormone, when it occurs during childhood, it leads to dwarfism. Hypersecretion of growth hormone during childhood leads to gigantism, whereas hypersecretion during adult life leads to acromegaly. Dwarfism means the person is short in size. Gigantism means the person is very tall and long in size. But hypersecretion during adult life, it leads to acromegaly. That means too much of growth of the facial bones, and hands are also very large and like a spade, and the skin of the face and the hands are also very. Somatostatin is a peptide which inhibits the release of most of the hormones such as growth hormone, thyroid stimulating hormone, prolactin, insulin, glucagon. All these hormones are inhibited by the peptide, that is somatostatin. Next, coming to the thyroid stimulating hormone. So as I told you, it helps in the synthesis of, it influences the uptake of iodine, and it helps in the synthesis of T3 and T4, that is thyroxine and triiodothyronine. So these hormones are secreted from the thyroid gland in response to the thyroid stimulating hormone. Now it also helps to control the growth and activity of the thyroid gland itself. Apart from releasing the hormones from the thyroid gland, it also helps to maintain the activity and growth of thyroid gland. The next is adrenocorticotropic hormone. It controls the growth of adrenal cortex and the synthesis of corticosteroids. So it leads to the synthesis of corticosteroids such as glucocorticoids and glucocorticoids. So within the corticoids we have cortisone and hydrocortisone. The main function of these corticosteroids is to facilitate the metabolism of carbohydrates. And mineralocorticoids are responsible for maintenance of electrolyte balance in the body. So these are a brief overview of different hormones and their functions in the body.